everybody for joining. Thank you, Dr. Kishore Chawla and Dr. Vidya Kora, Dr. Vijay Appareddy, uh, and Ravi Kohli and Dr. Sampath Shivangi, and all the panelists and speakers. Thank you for joining, and all the audience. Thank you so much.
So thank you, Dr. Reddy. And Dr. Seema Arora, you want to say a few words before we start the actual proceedings as well?
This is Seema Arora, Chair Board of Trustees. Welcome everyone. Thanks for attending our conferences, and thank you to the organizers and speakers. And I'm looking forward to trying to listen to what they have to say today. Thank you for giving me a chance to speak.
Thank you, Seemaji. And we have some interesting topics we want to discuss. Actually, what we're going to do might actually kind of illustrate the point how we're going to improvise audio visual of the Zoom today. And Dr. Kishore Chawla, he is the chair of the Board of Medicine of West Virginia. Board of Medicine is here today. And you want to come on, Dr. Chawla, and I will introduce Dr. Chawla in a minute. Let me share my screen. And today we have activities by AAPI leaders, many initiatives that have been taken on their own, as well as on behalf of AAPI. They're all here to discuss some of their successes and some of their challenges they have faced. And we have Dr. Chawla, who is Board of President of West Virginia Medicine. He is a graduate of Usmania Medical College, a renowned cardiologist in West Virginia, Charleston. He has the senators of West Virginia, as well as the governor on his speed dial, as well as the past governors. He's very bipartisan. He has brought on both the Republican as well as Democrat senator to the legislative action that he spearheaded. Dr. Chawla, can you please go ahead and come on board? I'll stop sharing here.
I'm on board. Can you see me?
Yes, we can hear you.
Thanks a lot for your kind introductions, Ravi. And I really appreciate AAPI, Dr. Suresh Reddy and Dr. Seema Arora for giving me this opportunity to address this elite crowd. I've been practicing interventional cardiology in Charleston for the last 31 years. And as Dr. Kohli said, I'm the president of the Board of Medicine. I've been a member of the board for the last 7 years, and I've been the president for the last 2 years, and I have 3 more years to go. The board has about 10,000 physicians and about 1,000 physician assistants and more than 100 podiatrists in the jurisdiction. Obviously, as any board, we do the licensing, complaints and compliance, and we really work in sync with the legislation, especially during this kind of emergency, to facilitate the work for everybody. I was asked to talk about the legislative initiatives taken by us during COVID-19 emergency. We did a lot of work at the state level. My executive director, Mark Spangler, is also there. And we tried to do a lot of stuff to facilitate patient care. And we took several legislative initiatives. Naturally, these are specific to West Virginia, but I'm sure more or less every state did something like this in some kind of format. What I'll do is initially, I will go and talk about what we did locally for the state, and then what we could accomplish for the country about telemedicine. Okay? Ravi, if I can have my first slide, please.
Yeah, starting. Can you see the slides?
Yeah, I can.
Yes.
Okay, go ahead.
If you can go to the next one. As Governor Justice on March 16th, did declare a state of emergency for the state of West Virginia. The time frame for this emergency state is indefinite, and because of that, the board took immediate coordinated efforts to modify certain rules and regulations. The main thing for any board, the number one goal of medical board is to protect the public. Statutes and rules are designed to just do that. However, in these unprecedented times, protecting the public can also manifest in patient access issue. If everybody is locked down and can't get out of the house and can't go to their doctors, that's no protection. So we had to do a lot of stuff to make sure the patients get access to their physicians. The board began reevaluating all the statutes and rules to determine if any temporary suspension of the rules would be beneficial in our state's COVID-19 response. If you can move on forward. Our main goal was to help and facilitate the governors to draw some executive orders so that we can implement it right away. Usually most of the board's statutes, as all of us know, it takes months and months. But with the help of the administrative governors, Governor Justice, and Mark Spangler, who is our executive director, we took a very proactive approach in our response by staying abreast of all current information coming from CDC, HHS, and other federal and state agencies. We had to first suspend certain licensing requirements in order to develop an emergency registration for out-of-state MDs and PAs. This required the West Virginia board to provide information directly to the governor's office, requesting consideration for an executive order. We did as much work as possible and provide the details to the governor's office and accomplished what we wanted to do. If you can move on again, Ravi. The executive order paved the way for emergency rules to be filed by the Secretary of State office. The result, the bottom line, all retirees, inactive or expired licenses who have practiced within the last 5 years and have no adverse action on their licenses could register to practice. This is emergency registration and not a license. Essentially, if you are retired from practice for 5 years and you have been seeing patients and you don't have any consent order or any problems, you can practice. And usually the paperwork was very minimal and the turnaround of each licensee was less than 24 to 48 working hours. You can go to the next one, Ravi, please. We also developed a easy to use, free of charge, that's very important, free of charge process to register to practice in West Virginia. Many of our citizens live in counties that border other states. As a result, receive some or most of their health care from outside state institutions. Hence, this registration was very helpful because, as all of us know, when you do telemedicine, it is where the patient is, not where the doctor is. If you are in Ohio and doing a patient telemedicine West Virginia, that was illegal, not anymore during the emergency. So in the period of 2 months, whether we believe it or not, we added 1,000 practitioners who got emergency registration for West Virginia, and the count is still going on. If you can go to the next one, Ravi.
Yeah.
We did the same thing for retired MDs and physician assistants also. We can go to the next one also, please. This is as of 5/25, we added 929 MD registrants and 86 physician assistants. Next one, please. Also, we took out certain things in the PA Practice Act, where to where PAs and their coordination with the physicians, we went very loose. Also, next one. All, usually the licensing process usually ends from till on July 1st for physicians starting from A to L. So what we did was we extended all the licenses to be renewed till September 30th. This includes the controlled substances dispensing, the educational permits, PLLC license, medical corporation also. And you probably don't know what happened about, I don't know in other states, how many states you have educational permits. This is for educational permits are for the first year interns who can take care of patients in the hospital. They get a permit, not basically a license to practice in the hospital only. That would help the hospitals bill for the service. If you can go to the next one. Also before this, usually for any licensure, uh, usually the licensure committee meets first, and then it goes to the main board, and it takes some time. So what I did was, with the consultation, we abolished, we gave total autonomy and authority to our executive director and the licensing committee. So if they need a license, the committee is the one which decides to take care of it, and it does not have to be approved by the board immediately. Also, we issued a emergency ruling extending the 2020 renewals deadline by 90 days also. When this is one of the most important things we could do on telemedicine. As you know, in our state, in West Virginia, the telemedicine for a new patient, you cannot have a patient-physician relationship when you have audio only. It is okay for follow-up visits and subsequent visits, but for not for new patients. And that was suspended, and patients can be seen, or the patient-physician relationship can be established just for with audio. And then what happened is, this is, I mean, I was telling Ravi, I have been in practice for 32 years. By far, what we could accomplish with telemedicine is far as good as it can do, and that's probably the biggest accomplishment of my professional life. What happened when you, as all of us know, telemedicine is video. We need to have video communication. When when telemedicine was approved because of the COVID pandemic, the idea was they got rid of the HIPAA uh, issues, and you can do telemedicine on iPhone, Skype, FaceTime, or iPad. And that was the only thing they changed. When the problem was, we surveyed several physicians in our state, like one practice, which is primary care practice, which is in rural West Virginia. In the first week of emergency, they saw about 600 patients, of which only 25 patients could do video contact with the doctor. So with the new executive order by President Trump, what it said was a video contact is the same as an office visit, and the reimbursement and billing will be same as for an office visit. And obviously, because of our demographics and the fact that in West Virginia, 30% of the patients still have landline, and maybe 20% have flip Nokia and Motorola phones, and elderly can't get onto any smartphone. And really, I mean, it's thinking about it, if you are grounded in the house for 2 months, You don't want to show your face to anybody. You have not been to a parlor, salon, or anything. So what I approached Senator Manchin and Senator Shelley Capito. These are, as you know, Manchin is the Democratic senator from West Virginia, and Capito is the Republican. Then we said we need to do something. This is a rural state, and the cost of practicing or doing medicine is much more than what we are getting. And I gave them examples and I gave them affidavits and all those, and said that audio only was paying less than $30. Whereas with regular telemedicine, I'm talking about a good 99203 or 215, those codes, that they were paying about $95 to $100. So we actually wrote a letter to Administrator Seema Verma and DHS's Secretary, Mr. Hazar, requesting them to consider audio as telemedicine. And rather than the codes of 99441, we wanted it to be a video code. And after debate, they said there's a lot of resistance. It's not possible. Nobody, there's a lot of people out there who think that audio is not telemedicine. So then we went back to the drawing board. I said, okay, if the audio is not telemedicine, at least can we have parity of reimbursement? We can use the same codes. And because the emergency started on March 1st, we asked for retroactive from March 1st. And Senator Manchin, within 24 hours, he got signatures from more than 40 US senators in a bipartisan way, and it became the law within 24 hours. This helped every physician who does clinical practice and hundreds, thousands of patients in the country. That's why I said this probably was the biggest achievement we could do. And can we go to the next slide? I think we covered this. Next one. Okay. So this is what you can go to the next one. This we discussed already. And go to the last one, Ravi. See, again, go back, the last one. Okay, this also, we were in close contact with the health department and DHHR. Go to the last one, Ravi. Next one. Okay, click on any of the links. Let's say CDC information for providers. So basically, we are updating every day and what are the things which the licenses should know. And it really worked out really good. And because of this webinar, I contacted both the senators, and they were kind enough to send a message to AAPI, and Ravi can play that message.
All right, let's try to do that. So here is the challenging part, the audio and the visual, the telemedicine. We're going to do some improvising of the telemedicine here, a teleconferencing here. So let me get the video first. Let me pause it for a minute.
I'm Senator Joe Manchin, and it is.
You can't see.
1 second.
Play both.
It's an honor to welcome each of you this evening of the American Association of Physicians of Indian Origin, and to thank you for your unparalleled efforts during this COVID-19 pandemic. Now more than ever, your work on the front lines to keep our citizens safe and healthy is of the utmost importance in providing you with the legislative guidance and tools you need is vital to getting us through this healthcare crisis. And it has been a privilege working on your behalf to secure equal reimbursement of audio-based mental health services, which are extremely valuable in rural states like West Virginia. I truly appreciate my dear friend Dr. Chawla, who is instrumental in these efforts to ensure physicians are able to provide accessible and timely health care during this time of great need. Continuing to work together is what will get us through these difficult times. Again, thank you for your unwavering commitment to helping those in need. I will continue doing all that I can to ensure you are equipped to provide the best possible care to our citizens. Thank you.
So were you able to hear it, the message?
Yes.
Were you?
Yeah.
Thank God. We kind of brainstorming how to present the information in a meaningful way, and I'm glad you're able to hear it. And next we are going to play the message from the other distinguished senator, honorable senator from West Virginia, Shelley Moore Capito. So let me get her message ready. Okay, here it is.
Hi, this is Senator Shelley Moore Capito from the great state of West Virginia. My very good friend, Dr. Chawla, has given me the opportunity to greet you on your webinar at AAPI and to thank you for all of the great work that you do across this country for the healthcare system, for the patients and families that you serve. We are deeply grateful for everything that you do, particularly in this very difficult time of this pandemic. You've been essential parts of every community, making sure that people stay safe and stay well. I would like to say hello to my good friend, Dr. Chawla. He's head of our West Virginia Board of Medicine. He is a good friend of mine. He's a lot of fun at the same time, and I know he enjoys his association very much with the AAPI. So thank you so much. Stay safe and have a great webinar. Thank you.
So that's Shelley Moore Capito, a Republican senator from West Virginia, sharing her message with all of us. Thank you, Dr. Chawla, for your diligent work on behalf of all the physicians. To put a dollar figure, it's about $450 million of reimbursements have been returned to hardworking physicians taking care of remote patients in very tough terrain in West Virginia as well as rest of the country. So we really applaud your leadership and your activism in getting this legislation taken care. Mr. Mark Spangler, do you want to share your thoughts with us as the CEO of the West Virginia Board of Medicine? Vijay, can you unmute Mr. Mark Spangler?
Thank you, Doctor. It's just been a real pleasure to serve with Dr. Chawla through this time, and he's been very responsive and very effective in his advocacy, and just feel privileged and honored through this time to be working with him and with all of our colleagues throughout West Virginia and throughout the United States with our association with the Federation of State Medical Boards. And I think that our efforts, our collective efforts, are noteworthy, and there are none more important than you all for being on the front line and doing the wonderful work that you're doing. I applaud your efforts, and I applaud your commitment as we get through this trying time. The regulatory boards in each state should be a support, not only to regulate medicine, but also to ensure that patient access is available. And I believe that's that has been evident in the work that Dr. Chawla, Dr. Sheth, and others on the Board of Medicine in West Virginia have done. So thank you for the opportunity to greet you and to thank you and to join in your webinar tonight. Thank you, sir.
Thank you. Thank you, Mr. Spangler. Go ahead, Dr. Kishore. Yeah,
No,
Kishore.
I want to acknowledge my Vice President, Dr. Ashish Sheth. He is also here in the webinar.
Thank you.
And we are a good team. And if there's any questions,
Thank you, Dr. Ashish Sheth. Do you want to share any thoughts with us? We'll unmute you. Is that, let me see, are you identifiable here?
It's okay.
Okay, thank you. Thank you so much again. And if anybody has any questions, please put them in the chat box and we will answer.
Is that the chat?
Go ahead, Dr. Sheth. You want
Well,
to?
I echo the feelings of Dr. Chawla and Mr. Spangler. Thank you for all your efforts, and I'm sure that a lot of the AAPI physicians are indeed rural-based, and this legislative effort that Dr. Chawla spearheaded, I'm sure that a lot of the physicians will benefit from these legislative changes, or rather the rule changes that CMS implemented, so as to get parity in payment or to sustain our practices through these difficult few months. So thank you again to the team that we had.
Thank you, Dr. Sheth, for being here with us and sharing your thoughts and helping all of our physicians to practice the best care we can under the circumstances. And actually, if you remember, when the audio calls were not reimbursed in the beginning, we were all very upset. And when the tele-audio calls were received parity, it was retroactive to March 1st or March 30th. So not only they were able to accomplish it, they were able to put it in the retroactive fashion. So that's really an amazing thing. This is how the sausage is made, how the legislation is made. A few good people working really hard behind the scenes and moving the mountains with all their resources is really a sight to behold. Thank you so much.
Thank you.
And now we have two other stalwarts of AAPI as well as AMA are here. And we have Dr. Vijaya Aparedi and Dr. Vidyasagar Kora. Both are AAPI members for a long time and AAPI leaders as well. And now they're big leaders in AMA as well. So Dr. Aparedi is here. She will talk about some of the legislative activities that are happening in AMA and how it can be of value to all the physicians, including IMGs as well as Indian physicians. Thank you, Dr. Aparedi, for being here at a short notice. And please, Dr. Aparedi is a distinguished child psychiatrist in Tennessee area. She trained at Mount Sinai program in child psychiatry. She has the distinct honor of being appointed to two presidential commissions, first by President Bush for 2 terms, and now by President Trump. She's the first Indian woman appointed by a president to a commission of this honor. So please welcome Dr. Vijaya Aparedi. Thank you.
Okay. Thank you, Dr. Kohli. Can you hear me?
Yeah.
Okay. So good evening, everybody. I'm trying to get out of the glare. I'd like to thank AAPI. I'm a long-term member of AAPI. I was the past chair board of trustees, so AAPI is very dear to me. But today I'll speak a little bit about my role in the AMA Council on Legislation. I wear multiple hats in the AMA, but the Council on Legislation is what I'm primarily involved in now. The Council on Legislation has about 10 members, and we have about 15 full-time attorneys, which are support, and many lobbyists who work with us on crafting legislation, reviewing legislation, working with congressmen, senators, and also with all the regulatory bodies. We work with CMS, CDC, FDA, all the regulatory bodies. I mean, there's a long list. We not only review legislations, but we also suggest to the board about any proposed new legislations that would be important or that are coming up. And even it's the board's prerogative to let us continue with our work. No other council can make decisions about medical legislative activities until it goes through the Council on Legislation, other than the Board of Trustees. They can. The other role we have is model legislation. We write up model state legislations so that we can give it to the different states and they can be used by the states for their state legislature to accomplish their goals. We also go on to Capitol Hill several times a year to lobby on the issues that we have that we would like to present or that we're working on that that AMA has an agenda for. Now, since in the interest of time, I'm going to just touch on a few of, I'll start with immigration. Um, with, um, with AMA, the highlights are there are a lot of issues with for IMGs or immigration that we've worked on. Of course, the one that is making the rounds now is the healthcare workforce resilient bill, which will allow recapture of 15,000 unused employed-based physician immigrant visas from prior fiscal years. So, so it can be used by the IMGs. And that's is being, AMA is lobbying for that. And so we'll have to see how, and it's both introduced both in the House and also in the Senate. So, so we're trying to have a bipartisan approach and deal with it in every direction. And I can elaborate on it further. The other act is there is the HEROES Act, as most of you know. It's the Health and Economic Recovery Emergencies Act. And what AMA is advocating for the Conrad 30, the processing, employment, and authorization cuts. If you look in, it's called the AMA HEROES Act. It's section 191201 and 191204. There'll be details of the advocacy AMA is involved in for the IMGs in order to move the issues forward. The other things that we have been involved in is labor condition application to expedite physicians to work in other locations. And I guess so far what they've approved is telehealth in different locations. So it's still in the works. This is for individuals, J1 visa holders, who in the past could not move from their location at all. There is also, we have been lobbying to have with the USCIS to expand processing of H-1B visas. And also there was a ban on the new residents who had matched to come in. So that has been opened up, the processing, and also the J1 visas holders are already here. And what is also important is that the UCIS has announced a temporary waiving of the immigration consequences for individuals who do not meet full employment requirements. The AMA had originally asked for to extend from 60 days to 180 days grace period. So, so individuals on visa who are non-citizens and can have lose the job or pull out from the job, have time to look for a new job. And also they've asked to protect spouses of the dependents who are on H-4 visa and their children. So all these are in the works. I have, for those of you who are interested, there's a resource guide, guidance for IMGs during COVID, and it's updated every day because there's just so much going on, and every day there's something that changes. Now it's I can answer questions on these later on. Just to save time, I'll move on.
So thank you, Dr. Apparedi.
Yeah, I just want to, no, I have a few more things just to say quickly.
Yeah, go ahead.
I want to talk about the non-IMG issues that we're working on. Since the COVID has started, we have been working on, there's a COVID-19 resource center. Every day we work on this to have modifications, in the beginning modifications to the PPP, to the CARES Act, to also, since the telemedicine and audio has been in place, we have sent model legislation to the different states so that they can advocate at the state level, because as you know, each state, now some states are threatening to pull telemedicine coverage after June 1st or July 1st. But we've asked in the model legislation that they follow the Medicare model. So those of you who are active on your state level, please avail that. And there are some that were very actively being worked on that are very important for physicians. But right now, you know, like reducing prior authorization burdens, surprise billing. So with surprise billing, what we're advocating for is protecting patients so they don't get out of network billing, but at the same time, protecting the patient's access to care. So we've been asking to have that it should be, the rate should be determined by independent claims database, and that there should be an independent dispute resolution process. The other thing we were very actively advocating before COVID was MACRA, to implement positive payments adjustments for physicians to replace the last 6 years payment freeze, extend advanced APM bonus payment for additional 6 years, implement technical problems to get over technical problems. And we worked on augmented intelligence, which is very important. So the list kind of goes on. And but I do want to say that, you know, right now I'm a delegate from Tennessee, but I was a delegate from AAPI for a couple of years intermittently. So AAPI has introduced a lot of resolutions that have become AMA policy and that have been implemented. So so AAPI can be a very strong force. And I just want to say that, you know, we're all advocates in our offices, in our homes, but if every one of us advocate on the national level with regulatory agencies, with Congress, then, you know, the 100,000 of us can be a really formidable force. We've also, just to add, we've co-signed some letters with the AMA about some issues. You know, they ask different organizations about different issues where we co-sign the letters. So we've had impact with the AMA from AAPI. And so I'd like to, I'm open for questions later on, but I'd like to thank Dr. Suresh Reddy and Dr. Kohli for giving me this opportunity to speak. And I'd like to commend Dr. Suresh Reddy for his untiring, unrelenting, dedicated service to AAPI. Thank you.
Thank you so much, Dr. Vijay Appareddy ji. And really, you have been an exemplary leader for AAPI as well as AMA, serving physicians all across the country. And you took my call this morning and just came on without any question. That speaks so highly of your work ethic and your leadership. And thank you again for joining. And please have your questions ready for all the panelists, and they're all here to answer your questions. And without much further ado, I'll have the next speaker come on board, Dr. Vidya Sagar Kora. He's also a very distinguished physician leader, both from AAPI perspective as well as the AMA perspective. And Dr. Kora is an internist, and he has been also active in AMA in the past. He is the AMPAC, American Medical Association Political Action Committee Chair, and he was past Indiana Medical State Board Chairperson. And he has been an unrelenting leader as well. And he's here to share his experience and his advice and his role in AMA activities. Thank you, Dr. Kora, for coming on.
I wanted to go to the chat.
Thank you, Dr. Kohli. Before Dr. Appareddy leaves, I just want to give a shout out for her for the extraordinary amount of work she does. Especially Council on Legislation is a very important council at the AMA, and it takes a lot of work, long hours. Thank you, Dr. Appareddy, for what you do. Before my comments, I want to give a shout out to the AAPI leadership. You're doing a phenomenal job and Dr. Reddy and Dr. Kohli and all of you, Dr. Arora and my nephew, Dr. Katula, Satish Katula. So thank you all for what you do. And the last thing I want to say about Dr. Kishore Chawla, you know, Kishore and I go a long way in Hyderabad. Kishore, what you have done in West Virginia is absolutely phenomenal. Here is the thing, a lot of organizations can do work, but the individuals who have personal relationship with elected officials can make a big difference. And Kishore, you have written actually the book on this as to how to make this happen. So I really appreciate your work in West Virginia. The other thing that I really liked about your approach is bipartisanship. In a country which is deeply divided, I think it's very important that we address our issues and solve our problems by building consensus and reaching bipartisan solutions. So you have done a phenomenal job there, and also getting parity for in payments for telephone visits it has been an extraordinary accomplishment. So thank you for your efforts in that area. Dr. Kohli, I just want to mention to you that I'm in the thick of a campaign. I'm running for the AMA Board of Trustees, so next Sunday I'll know whether I win or not, but it has been an extraordinary experience. Every day I get several interviews because I'm, as a Board of Trustee member, we are interviewed by various states and specialty societies. And so it's been a very interesting experience. I urge all of you to consider becoming members of the AMA in addition to AAPI. And also, having been on the Political Action Committee for 8 years and chaired it for 2 years, I cannot tell you the importance of political action committees and what it does for advocacy. No matter how many policies we have or how many resolutions we write, unless we have the tools for advocacy, we are not going to be successful. And for tool for advocacy means we need to have well-funded political action committees. It's as simple as that. So please consider being part of political action committees, and that way we can have access to the elected officials, and then we can get our word to them and try to get the problems addressed and problems solved. In relation to COVID, one of the main areas I am focusing on in terms of advocacy is post-COVID, I think a lot of physician practices will be under extraordinary stress, extraordinary financial stress. And so what we need to do is we need to advocate for more funding for physician practices and physicians in particular, because what's happening is in whether it's in the House or in the Senate, money is being allocated to the healthcare systems in general. But I think it's important that we make sure that certain portion of it is allocated for physicians. I just want you to, all of you, to keep in mind that way in your relationships with elected officials, you all you advocate for the same thing. I think it has a great impact when many of us reach out to our elected officials. What has happened is because of the elective procedures not being done, and the patients are afraid of coming to hospitals and clinics. I think a lot of physicians are losing revenue, and there is a real concern that many of them may go out of business, and that's something we don't want to see that happen. So I think advocacy, there's never been a more important time for advocacy than right now. Dr. Appareddy also mentioned about MACRA and MIPS. You know, when we went on this journey of getting rid of SGR, it took many years of work to get rid of SGR, and what we got was MACRA and MIPS. So instead of threatened cuts, now we have a freeze. So our next step is to work on how to get positive updates every year, because we have to keep, work in a way that way the legislators, both the congressmen and senators, understand that the practice costs are going up, and they need to link the reimbursements to the Medicare Economic Index. When Medicare Advantage plans can get positive updates, every year, why shouldn't physicians who are also having the same kinds of pressures in terms of rising costs have similar arrangements? So I think that's something we need to keep working on. And if I'm going to be elected to the president of to the board of the AMA, that's what I'll be focusing on. Is allocated funding for COVID, specifically for physicians, and also in the non-COVID area, work on getting rid of the freeze and then going for positive updates every year. Now, in terms of telemedicine, I anticipate there will be more telemedicine as a result of COVID. And once our patients get used to telemedicine, I think they'd like to continue. And then we need to make sure that we work on removing any of the regulatory barriers that may be existing for telemedicine. Some of the things that Dr. Chawla has done in West Virginia are commendable, and that's something we can look at and then take it to the national level. I think those were some of the things I wanted to mention. I just want to, again, before I close, I just want to mention that advocacy is extremely important. And advocacy is a team sport. It's not just done by one person or one PAC. We all need to contribute to the PACs. But in addition to the AMA, whether it's the AMA or whether AAPI, all of us have staff who are going to advocate on our behalf, which is important. But I think we need to roll up our sleeves and we need to be doing some of this work, whether we email our elected officials, call them, have personal meetings with them from time to time, go to the Hill and advocate on our behalf of our profession. There is nothing more noble than advocating on behalf of our profession and our patients, and I think that's extremely important. So, Dr. Kohli, thank you for giving me this opportunity, and we'll stay in touch.
Thank you so much, Dr. Kora, for coming on to the seminar at a short notice and giving such an eloquent speech, and we really appreciate your leadership at the AMA level and your advocacy for the sake of patient care, as well as physician reimbursement and regulatory burden as well. Thank you. Thank you so much.
Thank you. Thank you very much.
And we have a couple of questions. One question was, is there any legislation to protect physicians treating the COVID? I can ask Dr. Chawla to address that, and then also Dr. Appareddy as well as Dr. Kora to also give their perspective on that.
Can you repeat that question, please?
Yeah, is there any legislative efforts to protect the physicians who may be treating the COVID patients, may not be able to provide the most effective care at all times due to lack of resources as well as lack of standard of care? That's how I would read that question.
So the question is related to liability protection.
Correct.
I think there are two questions regarding protection. One is there are a lot of students and residents have asked us about not having enough PPE. Now that issue has been going down now. Initially, there was a lot of concern about not having enough PPE. I think that's an area we should be very aggressive in our advocacy to protect ourselves and our colleagues. And regarding liability protections, I think liability protections are really state issues. And certain states like New York, I think they have come up with some rules for liability protection, and I will let Dr. Chawla talk about West Virginia. One other thing I wanted to talk about was about nurse practitioners and PAs getting unrestricted license in many states because of this emergency. There's been an unrestricted license for advanced practitioners. And one of the things we need to consider is that this license, unrestricted license that was given because of the emergency should be time limited. And it should, there will be a pressure from the organizations that represent nurse practitioners and physicians assistants to make it permanent. But that's something we should all be anticipating on the horizon and be prepared with our advocacy efforts. Those were my comments on that.
Thank you, Dr. Kohli.
Right. I'd like to make a few comments.
Yeah, go ahead, Dr.
The AMA has consistently You probably saw the AIM president, which has come on many of the CNN shows and news, asking that adequate PPE should be given. This is from day one, even till today, and also that the physicians need to have some kind of protection, because like Dr. Kora said, it depends on the individual state. But the other thing that they're working on in AIM is also working on, which is not completed, but we've written letters about seeing if they can be, if at least part of the student
Dr.
loans
Apparently,
can
your
be.
audio is breaking up a little bit.
Okay.
Can you see if you can? Meanwhile,
Okay.
yeah, go ahead, try again.
Audio is okay. Can you hear me now?
We can hear, but it's kind of breaking the tone. Yeah, sometimes the Wi-Fi connection is not strong. It kind of breaks up. So meanwhile, let me see while you can fix it.
Okay.
While I'll have Dr. Chawla give his comments. Meanwhile,
Okay.
Thank you, Dr. Appel. Please.
I'm
I
breaking
don't
up.
think there's any legislation in West Virginia for COVID patients protection. The only good thing which happened again is
You said nobody
telemedicine.
else is breaking up. I'm the only one.
Telemedicine, we can do even inpatient telemedicine. So quite often if there's a COVID patients, we are able to see this patient with an iPad from outside the room because we don't, the PPE protection is not as good. And no need for 10 people to do the same physical exam. So otherwise, I don't think there's any legislation in West Virginia for sure for protecting the physicians from liability.
Okay. So I have a question from Dr. Chirunomala. I will unmute you, Dr. Chirunomala. Can you, let me see if I can unmute you. Vijay, can you, okay, go ahead. Dr. Chirunomala, you want to ask your question?
Yes, please. The question is
Go ahead.
not only the liability protection. Can you hear me?
Yeah, we can.
Yes, sir.
Okay. Not only liability protection now, taking care of the COVID patients, that may be a little bit more easy, but liability protection related to telehealth care right now being delivered, and once it is reopened, which is happening pretty soon, from the future patients who may be blaming the doctor for something that could have been diagnosed, in the past, if not in the last 2-3 months, is there any issue related to that from the Congress or from states with liability protection?
This is Vijay Kora. I really don't think there's anything in Congress in terms of liability protection right now. The Congress, first of all, is not meeting because of the coronavirus situation. And then whenever it does, I think most of the work that is being done are for fiscal stimulus to ramp up the economy. And also to provide assistance to sectors that are currently hurting. There is some move on the Senate side for some kind of liability reform, but I think the House is probably not going to consider that. So I think the liability, as far as my take on things, liability protections are best accomplished at the state level. And whichever state each one of us lives, I think that's where we need to focus our attention in terms of liability reform. I'll turn it over to Dr. Chawla if he has any other further comments.
Let me go back to Dr. Vijay Apparedi. He might be able to connect better now with a little bit. Meanwhile,
yes,
I wish there's one.
Can you hear me?
Yeah.
Right. So I'm using my phone instead.
Yeah, go ahead, please.
Hello, can you see me now?
We can see you, but we can hear you very well.
Can you see me?
No, we can't see you. Yeah, go ahead. We are seeing you now.
Right. I think we have problems.
This is the problem I go through with my patients every day doing time research. So,
Yes, we do.
yeah. But anyway, I wish there's a moratorium on lawsuits, both for the delayed diagnosis during the screen. Go ahead, Dr. Aparadi.
Okay, well, I hope I have better luck now. Am I breaking up now, or is it better?
A little bit better, but go ahead, please. Let's try.
Okay, so again, I would encourage, we've sent model legislations down about telemedicine to the different states. And that, has strong wording about protections and about advocating to continue the telemedicine. So I would recommend all of you to contact your state legislative committee so they can work with your state legislature. And the other thing I wanted to say is that just a silver lining with all the COVID going on is AMA is trying to also see if we can have some amount of medical student tuition waived, and that's still in the works for individuals who work on the COVID front. I just wanted to add that one.
Thank you. We have another raised hand here, Dr. Kalyan Kodali. Can you unmute? Let me see. Vijay, can you unmute K. Kodali, Kalyan Kodali?
Yes.
Thank you. Hi, please come on board.
Yeah, thank you so much for giving me an opportunity. So basically, I'm one of the physicians from the state of North Carolina. I guess our team members have been involved with our organization. At the same time, we are working on. We are working on a legislation which is Healthcare Workforce Resilience Act. And advocacies have been going on for these bills, which is Conrad 30 program, Physician Access Reauthorization Act. And this new legislation that was introduced by 6 senators a few weeks back. And we want to see how much help that our organization can provide us in terms of getting green cards for the physicians who are serving the COVID front lines or who have been serving for decades in the country. So what is the stand from AAPI in terms of that? I'm one of the members in the green card backlogs. So I just wanted to ask this question.
Dr. Kohli, let me respond to that. First of all, that's a good question, Dr. Kodali. Here is my take on this. First of all, the AMA has put its weight behind, as Dr. Aparedi has mentioned earlier, supporting these bills. I think if we need to, there is a general consensus that we need more healthcare workers. So I think there will be, it will be positively received both in the House and Senate on both sides of the aisle. But the problem is that there is so much happening in Washington that this may or may not get the priority it needs. So what it needs is champions to push this, like Dr. Chawla did in West Virginia because of his personal relationship with both the senators. So I think what AAPI can do is AAPI can push it through its membership to have the AAPI members who have personal relationships with elected officials to push this. That's one thing. And the second thing is, as much as AAPI can push this, the success will be accomplished more if the mainstream medical organizations also support it, like AMA, and they're willing to support it. So I think we need to develop other cheerleaders for the legislations like this, and we need to build alliances with other medical organizations. And we could also build alliance with like hospital association, because they have an vested interest in making this happen, because they need healthcare workers too. So I think creating a coalition and an alliance who will support it will make it more likely that something like this will be accomplished quickly. but it takes work and leadership and coordination.
Thank you, Dr. Kora, for those very succinct remarks. Yeah, we are very much aligned with your needs. That's one of our agendas. But it's like Dr. Kora says, it's mainstream organizations, hospitals, as well as local senators can be the big players. However, we can reach out to them. And if AAPI has many leaders who are deeply connected to many senators, and we need to approach them individually. AAPI itself also had a committee to work on this, and we invited all the leaders, young leaders, fighting these backlog issues to join forces. We invited them also to come on our seminars, and they are also planning to join soon. And we're always here to help them. And but we need some guidance from you, what you need us to do. And we have connections, but the urgency of the issue sometimes requires fast action and quick action. And sometimes the committees take a long time to make changes. So we may need individual leaders, individual champions to work on these issues. Thank you for that question.
Dr. Kohli, I'll take leave. I have another commitment. Thank you for having me. I appreciate it. Thank you so much.
Thank you, Dr. Kora. Again, please give a big hand of applause to Dr. Kora.
Thank you.
Virtually. Thank you. Dr. Appareddy, do you want to take that question on GC backlog, if you have any thoughts?
Yeah, she need to unmute herself.
Yeah. Can you unmute Dr. Appareddy? Yeah. And meanwhile, there's another question by Dr. Saraswati Mopana asking about how to determine return to work status. I don't know whether there's any legislation because the testing capacities are limited, and how do we kind of form some guidelines on how to release patients back to work? Anybody wants to take that on? It's a clinical related question as well as legislative related question. Meanwhile, Dr. Chawla, you want to answer? Do you want to give some advice to youngsters on how to deal with this green card backlog issues, since you are a champion on how to get things done? Maybe you can give some clues and cues to them.
I think you just have to go through the organizations like AAPI and try to develop good relationship with the leaders. I was lucky enough that I have known for some time, but it's how you approach it and what your rapport with the leaders are. It starts from delegates in your state and senators from your state. And we need to reach out to the people and try to help them win the elections. And that's where they can help you and support you. That's simple as that.
Right. In American politics, the money plays a big role, but it doesn't have to be large sums of amount. I have seen even small,
it's
small
not
sums of amount.
No, it's not a lot of money. It's more moral support. And frankly, I have known these people for so long. I probably contributed $1,000 to each one of them. That's all. It's not more than the money.
Right.
You need to have your personal relationships. And how you develop it depends on you and how you get the door open. And as you know, in Hyderabad, when the door is open, apan to ghus jate. We go in. Very good. Very fast.
Thank you. Let's see, Dr. Appareddy, let me see if she's able to. So anybody else has anything want to share or questions? We're welcome to join. If you raise your hand, we'll let you speak. Let me ask Dr. Suresh Reddy what his strategy to help green card backlog. I know he has worked a lot on this COVID as well. He may be able to shed some light on how to take a challenge into problem into a challenge rather than a sort of unsurmountable problem. Go ahead, Dr. Reddy.
Yeah, thank you, Ravi. And actually, I was just trying to second what Dr. Chawla was saying. Hyderabad mein, like even if the door is not open, fir bhi ghus jate hain. So that's okay. We try to get in. And coming to the green card backlog, it's a big. Everybody can hear me clearly?
Yeah, very much.
It's a big problem. I think this problem came out 2 years ago, when the PAHA leaders came to us, and they are in a difficult situation. They are like I met them first at the legislative meeting, and we were having a legislative meeting 2 years ago, and a couple of them came to me, and they said this serious issue of green card. Green card is a funny thing. Until you get a green card, that's all you think about it. Once you get it, you don't even remember or even think about it. So it's a really funny thing. And we all went through that phase, getting green cards, citizenships, and once we get it, we don't even think about it. It's the same thing with residencies. Like I have helped so many residents and trying to get residency spots, but once they get and once they are done, they'll never talk to you again. Then I tell them, like, why don't you help people coming in until they come, until they get into residency? They're actually, one person even went a little bit ahead. Actually, one of my classmates, I couldn't help him, and he wrote a complaint against me to the medical board, something. So these are some crazy people. You have to watch out. So green card people came to me, and we said, and they were really hard stories. Some of them, one of the person, he got cancer of the kidney, and they said that if he cannot work, he has to go back to treatment in India. Well, treatment is not that bad, but still it's a very horrific story. So there were so many stories. Some people have been waiting for 10 years, and I was told at that time that they have to wait 20 years to get a green card. And kids, and when the kids become 21, they have to be on their own, and they have to go to India. So there were so many issues we don't understand. Once you get a green card, you don't even understand the plight of all these physicians. They are all in the rural areas. They are working very hard. They formed a big group, and we said we'll try to help. And they came to one of our governing body meetings. But again, as I said, once
we're losing the connection.
The river. But, and this year, as soon as I became president, I said we'll have a committee, separate ad hoc committee, and I made Dr. Raghuveer Khurra as the chair, and Ram Sanjeev as the co-chair, and Pawan Panchavati as co-chair. And we wrote letters to all the senators and all the congressmen in the country, and we wrote to the president, vice president, and we have been doing what we can do from our organization. Our organization, as you know, is a voluntary organization, and each officer and each member is a volunteer. And like we have limited time, we are not a full-time employees. So whenever somebody comes with an idea, this is what I say: like, you take the lead, we'll support you, but don't ask us to do all the work for you. But PAHA has been doing a wonderful job. We did a lot of news releases. We put in the newspaper, and we brought pressure on several congressmen and senators. And as you know, especially Dr. Chawla, Dr. Khora, and Dr. Appa, like, pressure has to come from multiple areas. Things in legislation or Congress or in the government doesn't happen because one prong goes and attacks. It has to be a multi-prong, like a fork, like 5 prongs, trishul, like 3 prongs. We should have a multiple prong attack. Then one of them works a little bit more than the others, but eventually things get done. But unless you have that kind of prong, go back and say, go ahead.
Yeah, it's good that your voice is breaking up the connection. Sorry to interrupt you. And yeah, I think, yeah, like you said, no good deed goes unpunished. Sometimes you try to help, and people bite your hand. But like you said, I plead ignorance too about the green card backlog issue until a few years back. I did not understand the magnitude because we were in a different realm of practice and families, and we're not connected to the green card backlog community as much. But we are aware of it. We are very much sympathetic and empathetic to that problem. We have all of us have your back, and please continue to work with us. We will help as much as we can. And we have Dr. Shashi Kupala, another young physician. He wants to also ask some questions or make a comment. Shashi, please join.
Thanks, Ravi. Hello, everybody. My name is Shashi Kupala. I'm a neonatologist. I live in Kentucky, but I work in Indiana. This is a good discussion we're having. Just to briefly say, I've been in this country since 2005, but I got my green card only last year. So I know the pain of waiting for the green card year after year. And you see the kids growing in front of your eyes and having a uncertain future is really not something I wish upon even on my enemies. So I've been active in AAPI a little bit and also very well connected with PAHA. So I know what's going on between these two organizations. I commend Suresh Reddy Garu for the work he has been doing, and Anupama Garu, Ravi Kolli, and Sudhakar Garu. Everybody has been supporting this issue, unlike in the past when people did not know about this issue. But now the leadership of AAPI is completely tuned in with the green card backlog issue. At the same time, again, you did not go through it. So obviously, as Suresh Reddy Garu said, most of the people don't understand. They don't have the first-hand experience with this issue. So what I think is knowing both the organizations and knowing the leaders from both the organizations, PAHA is doing a phenomenal job by themselves. There is no question about it. They built the organization from the scratch for the past 2 years. They're attacking this issue from several angles, from AMA, different professional organizations and societies. But again, as Dr. Chawla and Dr. Suresh Reddy were saying, AAPI has got a cloud. We have got 12,000 members in the AAPI, very senior physicians who have been in this country for 25, 30, 35 years. So probably those physicians at the grassroots level can talk to like one-on-one, can talk to just like Dr. Chawla can talk to his senators in West Virginia. So PAHA can use the AAPI's contacts just like those one-on-one contacts. But what I'm seeing is there's been a little bit of like communication gap between these two organizations. There is no question that AAPI wants to help PAHA, and PAHA also needs AAPI's help. But again, we just need, there is an ad hoc committee, AAPI and PAHA ad hoc committee, all those things. But still, there needs to be a little bit of more well-built communication between these two organizations. Thank you.
I totally agree and echo Shashi's comments. There is a lot of goodwill and a lot of relationships are being built between the leaders of PAHA, which is a Physicians for American Healthcare Access, basically advocating for green card backlog community of physicians. And we are all here for you. And we'll definitely want to work with you and do our best to help you. And let's see if we have any questions. So how many IMGs, MDs are in residency working H1 here, waiting for green card? Maybe Shashi can answer. How many people are waiting for green card? Yeah, go ahead, Shashi.
It's probably about, I don't know the exact number, probably PAHA knows. It's probably about around 10,000 physicians, I believe.
Okay, I have a question from Dr. Gokar Konda. I'll unmute him and he can pose the question himself. Let me find him first. Srini, what's your number?
Yeah, I think I'm unmuted now.
Okay, go ahead, Srini.
Yeah, thank you, AAPI leadership, for organizing this talk. This is very important talk at the very right time. So I think we all talked about what AAPI is doing and what PAHA is doing. And I really thank both the organizations for taking up this issue. I'm in the situation, I've been in the US for 16 years. And my son is like, he's just born right before we came in. He's 16 and he's going to be 18 soon. And he's still in the H1, H4 visa, right? So my biggest concern is if I don't get a green card in the next 2-3 years, he'll have to be on F1 for, to start a career on F1 in the US. So, I mean, I think, like Sashi said, there is some communication, gap between AAPI and PAHA. I think we need to bridge that. And we need to work more closely. Like Dr. Chawla said and Dr. Kora said, we need to combine our, unite our strengths and help each other in achieving this goal of, the Healthcare Resilience Act. So I request AAPI and PAHA to work more closely and then get this issue, move ahead. Thank you again for the opportunity.
Thank you, Srini, for your heartfelt comment. And again, yeah, we were very much interested in getting PAHA leaders to also join, but I'm glad so many of you are here asking the right questions at the right place to the right people. We have a lot of senior leaders here who can help connect the dots here. Thank you. And Krish, so one of the comments was that AAPI developed mentoring and training programs for AAPI members. And that's a very good thought. I think Dr. Sudhakar Janlagada's agenda is to mentoring and building a relationship between members, senior members and junior members. That also can help with these kind of issues on green card backlog. Dr. Vijay Apparati, you want to make any comments? You wanted?
I just wanted to reiterate what I mentioned before, the HEROES Act. That
we can't hear you very well. Yeah, Dr. Kalyan Kodali said there are 15,000 people waiting for green card backlog.
Right. Can you hear me now?
Yeah, a little bit better.
Right. So we were, AMA was also supporting the HR 2895 along with the reauthorization of contract 30. So all that is going to be included again in the HEROES Act.
Yes. The audio is not very clear, Dr. Vidya.
Yeah.
Okay. And Dr. Chawla, this question you might answer as a practicing physician as well as the chair of board. How do you give clearance for outpatients returning to work? Can you comment on that, Dr. Chawla?
I'm sorry.
The question is,
maybe on your bedtime.
as a physician as well as a leader of board of medicine, how do you clear patients to return to work? What is the guidelines?
After
with the
COVID,
testing, yeah, for the COVID.
See, I mean, in what way? I'm sorry, I'm still confused.
Because to return to if a COVID exposed patient, how do they get clearance to return to work?
If
how do
the physician is exposed to a COVID patient?
Not COVID. The patients are requesting clearance from the physicians to return to work after being exposed to COVID.
See, I have not had that scenario because I'm a cardiologist and nobody asked me whether I had to go back to work or not. It's again like CDC or whatever the HHS guidelines what you follow. And I'm sure if you go through, Mark, maybe you can answer my question. But if it's COVID negative, 2 weeks of quarantine, and people are going back home and they're not quarantined. So that's basically how it, I mean, it's more common sense in my opinion.
Yeah, thank you. We have a person volunteering to answer that question, but I don't know who it is. iPhone, it says. Can we unmute iPhones?
No,
Can you identify yourself by your name there?
one thing I want to make sure everybody understands, even though I have known, even though I've known the senators, the governors on a first name basis, this is the first time I went to them and asked them for a favor. So that's basically what I wanted to say.
Yeah, can you unmute 501-837-4527? Vijaya, if possible.
I think he joined as iPhone.
Right.
I don't know. There are 3 iPhones.
Yeah, 501-837. Is there any way to see the name? Okay,
No,
let me see if I can find it. 501. I can't see that number. Okay, anyway, so any parting let me ask for any parting comments or remarks by all the speakers who is here right now. Meanwhile, we're waiting for some questions. There is a link here by Dr. Anupam Pandey for probably employment clearance. You might be able to click that on the chat box. Thank you. And Dr. Chawla, you want to, I think you made your last comment. Yeah. And Dr. Apparedi, you want to say anything before we finish? And Dr. Suresh Reddy and Dr. Seema Arora will conclude the
I hope you can hear me. I was trying to get through to my iPhone, but it's muted. So can you hear me?
Go ahead.
Okay.
Yeah.
So yeah, I've been trying to jump between my iPhone and the computer. So I just want to conclude that we will have to join forces. I mean, the AMA is totally behind all the issues that I've just talked to you about. And I just wanted to reiterate that there is a HEROES Act that is also going to incorporate about the Contract 30 and the green cards and all those things. So please, if all the organizations can work with your your legislators, or every member works with it, then we can move that forward further. But this is an unprecedented time, so we have to. We're dealing with immigration issues. We're dealing with private practice COVID problems. But just speaking on behalf of the AMA Council on Legislation, we're working as hard as we can to move physician issues and patient issues forward.
Thank you. Your audio is not clear, so let's not.
Can you unmute my cell phone? Can you unmute my iPhone?
Which one? Let me check.
It's the 423-503-8179.
3. I think we were able to get it, but it's kind of break up for some reason.
Right. I have some.
That's like sometimes this technology is not foolproof. Yeah, with Wi-Fi connections can really be tricky. Sometimes even the weather changes can affect the Wi-Fi, I feel. And Dr. Lingaseti, can you unmute? Okay, one last question from Dr. Lingaseti.
Dr. Kohli, I just marked me that CDC issued return to guidelines last week. It's called the COVID-19 Workplace Guidelines, Health Safety Plan. It should be on the CDC website when to return to work.
Thank you. Yeah. Thank you, Dr. Chawla, for that. Yeah, go ahead, please.
Yes, sir. Thank you, AAPI, for.
Dr. Lingaseti?
Yes, sir.
Go ahead.
Can
you
guys hear me?
Yeah, we can hear you.
Perfect. So, individual Department of Health in every state, they do have control on who is COVID positive, going home, from the ER or inpatient hospitalization. So the data is given to individuals, Department of Health of the states, and they have a control on who has turned negative. Or there are two strategies. First strategy is test-based strategy, where before you discharge someone, you probably make sure they're negative. So the strategy follows the test-based strategy, where there are 2 negative tests done within 2 days apart or not. And the second strategy, where repeat testing is not possible, or you just cannot do it, that is called non-testing strategy, which is again is followed closely by Department of Health in the direction of CDC. So individual state Department of Health are the one in charge of, calling these patients up at their home and telling them that, yes, you are afebrile for last 3 days with no use of antipyretic medication and so on and so forth, whatever it is. They go through this questionnaire and say, Mr. X, you are free to be out of isolation, which means that they can either go to work or whatever they want to do, they can do. So it is up to the individual Department of Health of the states who follow these 2 strategies: test-based with the negative test, non-test-based with the symptomatology, fever, and so on and so forth. So I would leave it up to Department of Health officials to reach out to these patients, but I would make sure the patient data is given to them. Thank you, sir.
Right. Thank you, Dr. Lindsay. That's really a good answer, because it's a public health issue. It's not a individual patient physician issue as completely. It's a public health related issue. Health department do have a significant role, because all the positive cases are reported to them. So they have a database, they have a strategy. We need to take guidance from them. That's the common sense, but sometimes we don't realize it until you come to that question. Thank you. And so we'll conclude our session here. We're coming up to an hour and a half. And Dr. Suresh Reddy, are you here? Or we can have you. Dr. Seema Arora, you want to give any concluding remark at the end of this session? And then Dr. Reddy can give a vote of thanks.
Sure, Ravi, thank you. So I would like to thank the speakers, Dr. Kishore Chawla, Dr. Vijay Apareddy, Dr. Vidya Kora, for all the information they provided us, and also Senator Joe Manchin and Senator Shelley for joining virtually. So it's great to see the advocacy for physicians and the telemedicine reimbursements, important green card issues for IMGs, and also thanks to Seshi Kapala for giving us all the updates and the collaborative work being done between AAPI and PAHA. It's good to see that it's moving forward. Looks like we have to do some more pushing and some more work in that direction. And I would like everyone to help out in that respect. I think this is the time and the opportunity. And some of the take-home messages were that we should have good working relationship with our senators, and it's not as expensive as I used to think. Only $1,000 can do it, and you just have to be pushy. And as they said, open the door and push in. Good job. That was funny. So, but I think it was very informative, and thank you, Ravi, for organizing this. And thanks to all the audience for joining.
Thank you.
It's my pleasure and distinct honor to be here to represent AAPI and join the forces. And all of the AAPI members have been doing a phenomenal job right at the patient care level, as well as advocacy and education, as well as this kind of forum. They're all over the country. They are addressing many community organizations, social organizations, and educating the public and reassuring them, calming the fears. And I think all the physicians have been doing a phenomenal job. I'm really blessed to have all of you as my colleagues and my peers. And I look up to you every day as role models in my career, as well as my profession. Thank you so much, and have a blessed and safe day. Thank you for joining. Good night.
Good night. Thank you.
Thank you.